Good afternoon, everybody, and welcome to those of you who are joining us virtually this afternoon and those watching this back as a recording. My name's Adam Luke, and I head up the School Attendance Policy and Strategy team at DFE. The purpose of this afternoon session is to delve into some examples of local authorities in your region to share effective practices from local authorities who are slightly further on in the journey of implementing the working together guidance with those who aren't that far on. But I hope that everybody gets something from the session wherever you are on that journey. There's loads of really great stuff going on across the region in all local authorities. And whilst we're focusing on two detailed examples today, I'm hoping, as I say, that everybody gets something from one of their examples that they can take away and look at it in their own area. It's an opportunity really for you to learn from your peers and learn from how they got from where they started in terms of their starting point to where they are now, as we work towards the guidance being statutory from the beginning of the new school year. It's also an opportunity to see different ways of approaching each of the different expectations set out in the guidance. Both examples are very different. The point of the guidance setting out those core things in the way that they do is so that you can tailor and shape them to what you need for your local area and your local context. And that's why it isn't prescriptive on how you do them. So hopefully both examples will show you the way they've got to where they've got to rather than just where they are now. And it is with that really that I have the pleasure of welcoming Andrea from Rutland and Jill from Lincolnshire. You'll see in both of their examples similarities and differences in the way they've approached it. Hopefully, for those of you here this afternoon or watching back, you can see in one of these two examples a context that is similar to yours. If you can't, whether that's the starting point, the number of schools, the type of geography, whatever, if you can't necessarily see that in the examples this afternoon, this is one of a series of sessions nationally. There's been one from each of the regions, and they're all available on our YouTube channel, which we'll give you the link to at the end. So if you, as I say, if you don't see an example this afternoon that feels similar to yours in terms of size, demographic, etc., hopefully there will be one in that wider package that covers local authorities of all different types across the country. We'll make time after each of the two presentations for questions. You can put those in the chat as we go along, and I'll put them to the speakers, or there will be an opportunity to put your hand up and ask the question yourself of them when we get to that point. But if you could stay on mute in the meantime, it just saves any distractions for the speakers. And with that, we will get started, and it's my pleasure to welcome and hand over to Andrea.
Thanks, Adam. Hi, everybody. So I'm Andrea Tyler. My job title is Senior Coordinator Inclusive Learning, because we'd like a hyphen and a nice big job title in Rutland. But essentially, I'm the team leader of the inclusion team. We are the smallest county in Rutland. So we have lots of different things going on in terms of our area. We're seen as quite an affluent area. But we do have issues with our borders and with county lines for our young people because of where we're situated. So we have really good transport links out of our county, which can lead to some of the issues, as I've just said. So we've only got about 7,000 children in our county who are of school age. We've got 3 secondary academies, all of whom are very academic and very academic focused, and are all very competitive with each other. We've got 17 primaries, and then we've got 3 independents, 1 primary, 2 secondary, and 2 special independents. So part of, I suppose, our journey into how we're going to work together in the working together guidance is how we make some links with those independent schools that aren't necessarily there and haven't been there historically. So my role within the inclusion team is a full-time role, and I have 2 part-time members of staff who support me, and then a 0.8 support staff. I think lots of people, when they see that, think, oh, that's a lot for a team that covers such a small amount of children. But actually within our role, we cover school attendance, Section 19 medical needs, children without a school place, children that are at risk or have been excluded permanently from school. We cover penalty notices, we cover legal intervention, we cover children's licensing for employment, for chaperones, for performances. We cover CMEs, we cover reduced timetables, and we cover elective home education. So there's a lot going on in our little team. And I think sometimes that has its limits in terms of capacity. But I also think it's quite a positive thing in that we have a really good overview in our team over what is happening for our children that are school age within our county, because we're not having to make communications with lots of different teams. We are the team. So a lot of conversations happen within the office through our little team, and we hear lots of different things that are going on. As I said, with the smallest county, so it's a small team sort of overall. So we have very close links with our SEN team. We have very close links with our admission service, which is one person. We have very close links with our social care and early help colleagues. We all sit together in the same office. So that gives us, again, a really good opportunity for communication. And my team comes into the office once a week. And again, that's a really something that we put in place to help us with moving on towards the kind of working with this guidance, to make sure that actually we are having in that time sat together, we are having those conversations around what's working well, we are looking at how we can develop as a whole team, and the things that we feel are gaps in our service. So that's something we do on a weekly basis. We always have a catch up, and as I say, we're all sat together anyway. One of the kind of points on this first slide was, when did you start kind of implementing the guidance? And I cheekily took that out because I thought, I actually don't think I can put a date on it, because we've always been a service that wasn't traded. So that's wasn't a huge change for us. We've never been particularly focused on legal enforcement, so that wasn't a massive change for us. So I think a lot of the things in the guidance we were already naturally doing. And actually what that's enabled us to do is to look at how we could make that move quickly, and how we could look at what the gaps were that we felt we needed to do in terms of supporting our schools. We've always met with our schools quite regularly, particularly our secondary schools. As I say, they're very, very competitive. We only have 3. And that can be a problem in itself in terms of kind of shifts and culture shifts. So we've always met with them quite regularly, and that's kind of continued as we've gone through, but we have made some kind of changes along the way, which I'll talk about. I think that's probably it on that one, Vicky. So in terms of the data, as I've said, we kind of sit very closely with all our sort of children's services colleagues. So we pull in data from kind of various teams. So from the SEND team, but there's a lot of crossover between my team and the SEND team. So for example, my team holds all the Section 19 cases, even if they have EHCPs. So there's a lot of crossover working with our SEND colleagues to make sure that provision is delivered through the inclusion offer with Section 19, but also through their EHCPs. So there's a lot of kind of sharing of information, including kind of raw data. We're taking data from our early help and social care front door. We work really closely with the virtual school and our virtual school head, and we work really closely with community safety. Again, I talked a little bit before about county lines and the kind of issues we have around that in our county. So community safety do a lot within our schools around child exploitation. We also take, we've taken data from surveys from school staff. We've taken data from surveys from parents, particularly around our ANA project, which I'll talk about in a minute. We've looked at things like children that are under the EHCP process and what their school attendance and SEND needs have looked like as they've travelled through school, what their attendance have been like. And then we've also looked around things like children that move from mainstream to special and what their attendance have looked like. So what we've tried to do is kind of gather a bit of a picture around what children in our county are doing in terms of their school attendance. In terms of where we have looked at how we support our schools, so something we put in place quite quickly when the Working Together guidance came out was to kind of look at where we felt we needed to focus. So we've reg-rated our schools. Obviously, that's a fairly simple job for us with the 24 schools that we've got, and I realise some people have got a lot more to deal with. But for us, what we've done is rank them in terms of their actual attendance rates, but also in looking at how they're using other services that are available to them, whether they had a new leadership team, whether they've had new attendance staff this year, and whether that might present them with some kind of training needs and support needs. We also looked at them in terms of referrals to our SSP. So our SSP is the Schools Support Partnership. This is a project that all of our schools bought into through our schools forum. And what it does, it gives them access to an SEMH team, so specialist teachers. And it also gives them access to things like speech and language assessments, EP support, play therapy, CASI counselling, those kind of things. It's a bit of a toolkit for kind of SEMH support, which is something that was identified as an issue. And so when we rag rate, we're looking at whether we've got particularly high referrals for support, and also in their schools where they're not actually referring. They're all paying into the pot, and the pot is set out by the coordinator in terms of need. So if you're not referring as a school, you're not actually getting what you paid into it. We kind of look at why that's happening. We do in the inclusion team do a lot of work with our SSP. So we meet regularly as a team to look at things like yesterday we looked at exclusions data, for example, in our primary schools. And again, whether we needed to put a little bit more support into some of those schools, whether there were hotspots and why the children were kind of getting towards exclusion. So that's the kind of thing we're doing with them. They handle all of our primary type cases where there are initial attendance issues in terms of offering that support level of SEMH needs. So schools are expected to follow a graduated response. They're expected to flag really early, and they're expected to talk to the SSP about needs that children might have that aren't being met. And they will handle those cases right up to kind of being quite complex. In terms of secondary, we're much more involved. So we meet with all of our secondary schools every 6 to 8 weeks alongside the SSP. And that gives us an opportunity to look at cases. So very complex cases where we've got entrenched attendance issues, but also to be picking things up like year 7 siblings that we might have concerns about that have gone through the school. Children that were flagged to the SSP in primary that have transitioned and might need support in the secondary school. So I think what we've really focused on is building links between what is going on in our county and what the gaps are, and also building links between our primary and secondary schools. Not necessarily that they will go and have lots of conversations with each other, because we know that doesn't really happen, but that by having the SSP running right through, we know who those children are that are coming through. And if the schools aren't highlighting them themselves, there's kind of an extra layer of, we know about them, do you know about them, and what are you putting in place to support them? So I suppose really our framework has been around SEMH needs, because that's what was kind of highlighted as where our attendance issues were coming from. We created a framework for all of our schools, so it's a 1-page document. It's very much in line with the Working Together document in terms of what they should be doing with their attendance data, what the next step is and what the next step is. And it's basically a flow chart that we expect all of our schools to follow before they're bringing cases to us as entrenched issues. They should have considered things like the SSP, they should have considered early help, they should be looking at their data and talking about what it shows them. Because I think what we've had in Rutland is, because we've never been a traded service, I think sometimes we've almost shot ourselves in the foot a little bit because we've handheld a little bit too much. And so I think probably one of our biggest challenges has actually been pushing back to the schools and saying, no, actually, we expect you to do this before you come to us. And we won't be entertaining conversations where you haven't put the graduated response into place. We've also invested in an ARNA project to go alongside the SSP. So lots of you will have heard this called EBSA. We call it ARNA in Rutland, so anxiety related non-attendance. That was kind of a deliberate choice in terms of the non-attendance rather than school avoidance. So that project is a 3-year project that we've invested in with an educational psychology firm. And what we've done is create a tool for our schools to use as part of the graduated response. So although it's there for children with anxiety-related non-attendance, we would say that any kind of attendance issue, they can be using the ANA tool. And the ANA tool is essentially a questionnaire. So it has a questionnaire for parents and a questionnaire for children of secondary age, and they mirror each other. And what it does is looks at things like, what is your journey to school like? And is there anything difficult about that? What is difficult about the school building? What's difficult about lessons? Have you got any difficulties around friendships? What's difficult at home or good at home? So it's kind of an unpicking tool, I suppose. And as I say, for secondary age children, it's a very similar questionnaire to their parents. And then for primary age children or children with SEN, we've got a card activity with pictures, so they can sit with an adult. The adult shows them the picture cards and literally records what they say. So again, it follows the same system. What's difficult about home? What's difficult about travelling to school? What's difficult about the school environment? And it just enables school staff to get that information from parents. It covers some really tricky questions. And I think what it's enabled school staff to do is ask tricky questions without having to actually ask them out loud to somebody. And it enables parents to have space to fill that in, again, without feeling like they're having those conversations in front of somebody. What the school staff then have to do with that information is put it together, and they're expected then to have a meeting with parent and with child to talk about the barriers to attendance that it's brought up. And again, that's part of our graduated response. It's expected that they do it. We have 2 members of staff from each school were trained on the ANA project. We're just about to redo that because we've had a bit of staff movement, and there's ongoing supervision with myself and with the EP. So I've just come from that meeting now where we've talked about what's working well for them, and they've talked about things like the tool has allowed them to unpick things that they wouldn't have even thought to ask. It's helped them to have those difficult conversations with parents because they've already supplied the information. So it's then, okay, you've supplied with that information. Now, how do we move forward with that rather than having to spend the time asking those questions? So I think that's been quite key for us in terms of how we've kind of moved forward with our schools. So we've made that pushback and we've said to them, you've now got to do these things, but we've also tried to upskill them to make sure they understand how to ask those questions. And what we found initially when we did the ANA tool training was that there was a lot of pushback from schools to say, well, why would you ask them if they don't like our teachers? And we were kind of going, well, because we need to know that actually, if that's a barrier, we need to understand what the child's perception of that is. Or why are you asking them if they think they've got ADHD? Well, because if they think they've got ADHD, then actually that's a potential barrier. So it's been quite an interesting road in terms of getting them to kind of run with it. But I think we're about a year and a bit in, and the feedback now is really, really positive. So they do feel it's helpful. I just had the meeting with the secondaries has just said, as soon as anxiety is mentioned on a text message from a parent to say that they're not coming in, as soon as there's any kind of inkling from a member of staff that there's an issue around attendance, as soon as we're getting the regular tummy aches, the regular headaches, they're sending that form out straight away, even if that child is at 100% attendance, to find out what is going on for them. So that's been a real shift for us in terms of how we've managed to move forward. And it's not really anything that we've done internally in the local authority. We've given them a tool and supported them to use it. But ultimately, it's them on the ground that are trying to pick things up much earlier. And I think what it's made them realise is that they weren't picking up things very early. Things were becoming really entrenched and really, really difficult to manage. And they still have some of those cases. And I think what they're now realising is, had they gone in there a little bit early, maybe they wouldn't be in the situation they are with those children, which is a massive step forward. Do you want to move me on, Vicky? Okay, and I've probably covered a little bit of this, but one of the things that we try and do is get out to as many meetings as we possibly can. So we try and attend our Senko network, we try and attend head teacher briefings, we have those termly meetings with our secondary schools. So we call them SSP and attendance meetings. So there we'll go and have a little conversation at the beginning of the meeting, just myself or my new team member, around the strategic side of attendance. And then the SSP will join us and we'll talk about those cases and those groups and what kind of work we might need to put in to support attendance issues in school. As I said, the Honour Project has trained 2 members of staff. And then we also offer drop-in attendance sessions. So these were put in place really because of a capacity issue. So at the beginning of September, I took on the leadership role within the team, which meant that I hadn't got an officer below me because I was doing that job. And then I had another officer go off on long-term sick, and I've only just managed to replace her. So I've had a new member of the team start this week, and I've got another new member of the team starting in 3 weeks' time. So for the last 8 months, it's just been me and a support member of staff. So realistically, there was no way I was getting into primary schools to do those termly meetings. So what we did was I've set an afternoon aside every month where anybody can just book an appointment within a time slot of the whole afternoon and come and talk to me about any issues that they've got relating to attendance. And that's why we focused on the targeted support meetings just for secondary this year. We've brought them in line with the SSP because what was happening is I was going to an attendance meeting. 2 weeks later, I was going to an SSP meeting and we were talking about the exact same things because it is all intertwined with our response. We have a couple of hours with each of our schools and we talk about those signposting opportunities, talk about pupil groups, we talk about issues that they've got in terms of what their data is showing them. So we've got one of our schools that are piloting an attendance push on free school meals children because their attendance last year and their attainment was down. So it's encouraged them to look at what they can do within their schools as well. And then we also spend that time talking about potential referrals that they might want to make as well. We've had a bit of a restructure. So whereas we used to sit within the early help team, we don't anymore. We sit within education. And I think that will be quite interesting moving forward to hopefully keep those really good relationships with our early help and social care colleagues. But essentially, we have now moved into different teams. I won't make it sound like it's been easy in terms of the challenge and the pushback. So I've had many a ranty email from a school saying, I don't understand why you're not helping us. I don't understand why you're not picking these children up under Section 19. And I've very gently pushed back and said, because you haven't done everything we've asked you to do first. And that's probably been the biggest challenge. And I think the other challenge that I hear talked about a lot on these kind of meetings is around educational neglect. So when we have to push those cases to a more legal forum, getting those social care colleagues on side to understand that actually we are at the end of the road. We have offered everything, school have offered everything, support services have offered everything, and we're in a situation now where we actually need a little bit of backup from social care around neglectful behaviour, and we're taking these parents to court for a reason. It's not something we do lightly. So I suppose there are kind of challenges, and they're what we'll be kind of carrying on working on over the next school year. I think that's probably me.
Perfect. Thank you very much, Andrea, and so much exciting work going on. I know you've said to colleagues there that you were moving towards this approach over a longer period and you were therefore at a sort of head start to many other people. But I think that shouldn't betray the fact that you've done a lot of extra work, you and Helga, to get this to where it is, which is really lovely to see. Questions for Andrea, either in the chat or hands up. One from me, Andrea, while we wait to see if there's any from anyone else, if that's all right. You spoke a lot about being really clear on what schools can expect from you, but what they need to have done first, and that is an area that has worried people, not just in this region but across the country, about sort of managing schools' expectations. What are your sort of top tips for people who are sitting there thinking, I need to do that, but where do I start?
Breathe before you send an email response
Yes.
back. Sometimes I think we just go back to the paperwork that we've kind of distributed. We go back to the attendance framework, and we're just gently pointing out, actually, where have you done this? So always start with, can you tell me what you've done so far, before I start with what you haven't done, and then sort of gently go, well, actually, I think you need to look at this and this. And I know it feels really big and it feels really difficult in terms of what you're trying to manage, but actually we need to follow this response. Otherwise we could be picking children up that actually don't need the support we're then offering. So we need to make sure that we've offered everything. So I think the communication with secondaries helps, that regular communication, and the fact that it isn't just me. So on our SSP meetings, we have our SSP coordinator, she's independent. We have one of the EPs that works in the SSP, so he'll come along and he can give that case advice as well. I have an early help worker that sits as part of my team. She attends as well. So what we're trying to do is put a kind of a support system around, so it isn't just me going, I'm not going to do anything, I want you to do it. It's okay, what can everyone else in the room suggest that we might not have thought of yet? And I think they take it better because it's not just a person.
Yeah, that's helpful. Thank you. And another thing you touched on quite a bit in the presentation, but again, a sticking point for some people is if you've got a small team like yourselves, you've got to take a step back and recognise that you can't do all of this as a team. Everything that's expected in the guidance can't be delivered from your small team. And how do you make best use of other professionals and other bits of the council? That really shone through when I was with you in Oakham. But again, tests, sort of tips and pointers for people who are thinking about how would I go about starting some of that.
And I think this is where it's difficult because you only know what you know, don't you? And I think in some ways we do have that advantage that we are small, so we do know each other well. I think one of the things that I've taken advantage of is the virtual school and the extension to duties. So our virtual school appointed an education advisor to work within the virtual school. So we've taken some of her time to look at around attendance for vulnerable students and those that might be at risk of ending up on a SIN or CP plan, to make some more relationships with our schools, but also to offer kind of training for schools. So again, I think it's that offer of a wider team. So it's not just myself, as it has been for the last academic year, but or when my team is full, there still only will be 3 of us that are forward facing. So I think that has helped. I think that we have a lot of feedback between myself and the early help team around what schools are telling me. So quite a big thing at the moment is parental mental health and parental anxiety around their child's anxiety, and schools feeling that actually when they're trying to say to parents, well, actually we've put this in place and we'd really like you to try and do it, that parents are finding it quite difficult to trust that because they've maybe got some anxieties themselves. So I've been working really closely with our early help front door to try and look at what parenting support we can put in place prior to the early help support or the early help offer, that parents can just navigate themselves as a universal offer. So that's something I'm hoping that we can put into place so that schools aren't having to refer, but they can signpost parents to try and put that extra level of support in before things escalate.
Lovely. Thank you very much. And thank you so much for being honest and open and willing to share with colleagues where you've got to and the journey that you've been on. I'm coming now to the sort of opposite end in terms of geographical size, to Jill and to Lincolnshire. Welcome, Jill, and over to you.
Thank you. Yeah, thank you. Hi, everybody. Yeah, I'm going to talk about Lincolnshire, and those of you who don't know where it is that big county that runs out up on the right. If you're going up the country, it has 5 other local authorities that border it, and it has a coastal strip as well, which all kind of adds to different dimensions around the attendance. Over 100,000 pupils in 384 schools. So a lot of schools. So part of what I'm going to talk about today is how we just manage that alone in terms of the capacity to give every school some sort of share of what we're trying to do. So we've got 182 academies and 165 maintained. Every secondary school pretty much is an academy. And as you can see, a number of special independents and so on. The team, this is just the attendance team. We've got, we're just recruiting an attendance lead who will supervise and manage 4 attendance officers who will be responsible for the school. So I'll talk about how that's split up later. we have myself, who's the inclusion and attendance team manager. I cover the attendance bit, but I also cover the safeguarding in schools, ethic minority, and the EHE and the CME, and so on. So it's much broader than just the attendance. And then I've got another manager who covers the attendance and the EHE and the CME and prosecutions and so on. So prior to the guidance coming out, we already had 2 attendance officers that we kept from the previous Education Welfare Service many years ago, to just look at compliance of attendance and offer a training and advice and guidance. So we kind of built on those 2 and doubled the number. Our starting point really prior to the guidance was legal enforcements and some traded offer. I've put the implementation down as 2023, but actually we did a whole year of setting up, getting ourselves ready for that, and that would involve the recruitment of staff, writing the strategy, putting some training in place for our social care and our early help, and I'll come on to that again later, preparing schools and designing our template that we use and piloting that. So all that was done prior to the year. So though it is a starting point, we had done quite a lot before then. Next slide, if that's okay. Thank you. So I think our starting point was to look at our data and see what it told us about our attendance in terms of, in this case, our authorising, our persistent, but also our groups of children. And no surprises really of what we found. I think we know where our issues are, but the data could reinforce that. So we came up with 7 priorities based on the data that we had at the time. So in Lincolnshire, our authorised attendance has always been quite high, which means the schools are kind of letting things go quite easily. And then although we don't really, if you can't counter that, you're going to have an increase in unauthorised absence, which is also not great, but at least we know what we're dealing with then, and we can address it in a certain way. And we also know we had our high absent rates in our special schools, our children with the HCPs, and children with the social worker in the same way as it is nationally. We also included in there, although we thought maybe temporary, but as you know, it's going to continue for quite a long time, and that's the absent rate of children with anxiety and school phobia. We also recognise that our children known to our youth offending service, Futures for Me, is high. Again, we would expect that, but it helps us to kind of put a spotlight on that particular group. Our attendance strategy is what you can see on the slide. And you can get to that if you go through the link. So in there it outlines, it includes these priorities, what we're going to do in terms of making sure attendance is everyone's business. So it brings in everybody within the children's services and wider, and what we think their responsibilities are, and also breaks down what we think schools could do to right from if their attendance is good to that severe, some suggestions there in terms of that. Next slide, please. So I popped this one in, and you probably can't see the data, but it's what we use to kind of look at those particular groups and some other groups. So as you can see, it might be small, but I'll come on to this in a later slide. We have 5 categories that we look at. So we have our expected attendance, and we have our persistent, and we have our severe category, but we've also put in our at risk of persistent and at risk of severe. A lot of our schools fall into the at risk of persistent absence, so we wanted to build that in there because they could slip either way really. Hopefully they're going to go up to the expected attendance, but it's quite likely that could slip down into the persistent absent group. So we wanted to sort of keep an eye on those. So without explaining this data, what we're looking at in terms of this colour coded, and this is 2021 22 to 2022-23. So we're not expecting to see anything because we weren't the strategy wasn't in place at that point. But we would want to see high numbers on the right of the tables, and then in green, and then we want low numbers on the left, and we want it in red. As you can see, we haven't got that. So we know there's a lot of work to do, but this is the point of looking at the data, see if we can increase that a little bit as the next year comes along. So we'll look at that within the particular groups. So next slide, please. So again, with reference to data, we've always done an annual report that goes to our senior leadership team and our Children and Young People Scrutiny Committee, and it's data rich. So we have a data pack attached to this report, and obviously a lot of it is elective home education, children missing education, fixed penalty notices, pupils not attending regularly, and reduced timetables. But we've now added in attendance in school, making sure that's a substantial bit of it. And I think that really helps our senior leadership and our counsellors understand that they're all linked. So if you're going to see EHE going, if attendance is going to increase, that's when you might see EHE going down. Or if you bring one down, the other one. So they're all connected, and they're not separate. And I think that's really helped understand the resourcing that's needed around this area if you're going to have an impact on bringing numbers on down or up. So that's our annual report, which has been really well received over the years. Next slide, please. So these are the things that we have put in place. So we have an early help team and structure, and therefore we're going to lean on them to do the work around the barriers to attending. Our team is quite small, so we're not looking at offering that kind of support in terms of family support and individual children's support for 380 odd schools. We're never going to be able to do that. So we have to make sure our early help really understand attendance. And I think that was quite a starting point for us, because very good at what they do, but their knowledge of attendance was probably quite rightly not there. So we did quite a lot of work on training our early help and our social workers for understanding expectations around attendance. What does 85% mean, for example? Am I allowed to do that? If I do a fixed penalty, what does that look like? So lots of input on that, and we continue to do that. We've done input for the youth offending team, for example, on their training days. Again, they have really taken on board the data that we've sent them and the need to impact on that, and have their own targets around improving access to education and their attendance at those education provision, and kind of welcome working together on those. Things like sharing the attendance campaign that came out in January, we share that with all the schools, but we also share that with our Lincolnshire Safeguarding Children's Partnership. And in that operations group of the LSCP, we've got obviously voluntary sector and other children's services and outside. So they understand also what we're trying to do in terms of improving attendance. So if we've got health there, we're hoping that they can share the messages and put any changes in place that might, small that they might be, that might improve the attendance of children at school. So slightly linked to that, we did a presentation to schools last week, an update on the strategy, and we had health come to talk about asthma-friendly schools, and their starting point is, we know that asthma is sometimes an obstacle to children coming into school, and that shouldn't happen. They should be able to come into school with asthma. So let us help you as a school make your school an asthma-friendly school so children can come in. So it's kind of really started to unpick some of the reasons why children are in school and addressing those. So that was a good start to that. We're going to look at sort of diabetes as well as another one. We sit on the medical support panel as attendance advisors. So that's children that are going to go to a hospital school, but also children that are at the end of the EBSA pathway. So we can input on that as to whether the school are doing enough in terms of attendance or not. We share our aspirations with other teams. I mean, fortunately, I manage many of these teams, so I can sort of bring everybody together in that support. So ethnic minority and traveller education teams, so how they contribute to attendance. We know that travellers' attendance is not always its best, and then we've got ethnic minority groups that that we need to look at as well. So they have as a target to look at the attendance to support schools and put it on their referral form as well, as the reason they're referring is because the attendance is not good. And working with, as I said, working with early help, interim home tuition, pupil reintegration team on a return to school pathway, which means children that are not in school and need to go into school. And if we don't get that right in terms of children being ready to go back into school, when they get into school, they're not going to attend, and that's going to impact on their attendance. So again, there's lots of work to do around children missing and getting them back in, return from elective home education, again, making that a successful return to school so that doesn't impact on their attendance. I've just put in there the Gainsborough Aspiration Project as an example of Gainsborough is a small town, it's got a number of schools there. Attendance has historically been quite poor, and they've all come together and are working on improving their attendance and have got quite aspirational targets on that. And it's not just schools there, it'll be housing, health, to remove those barriers and raise that school attendance. So if that kind of works, we're going to kind of look at that and sharing that with other towns within the local authority. Okay, thank you. Next slide, please. Just an example of working with schools. This is our training programme. Everything you might need, hopefully, around understanding what a targeted support meeting looks like, to drop-ins where they can just have a kind of a much more informal chat about particular attendance cases, to picking off some of the key issues around issuing a fixed penalty notice or leavers and joiners, and making sure schools are using that correctly, making sure they are doing early interventions and so on. So we update that annually, and that's been really well attended by schools. We also regularly send out bulletins on new guidance and reminders of training, their legal requirements. That goes out probably weekly or fortnightly. We've got all our attendance documents in one place, so we know where to send schools when they keep asking us for the things that we've already told them about. So we just go there, it's all in one place for you. And we also include attendance information on our safeguarding updates. So so schools can see the links between children not attending well and potential safeguarding concerns, and kind of joining it up there. Next slide, please. So I'm going to talk a little bit about our targeted support meetings. As you can imagine, we've got 384 schools, so it was a bit of an impossible task to expect a small team to have those meetings 3 times a year with every school. So we looked at who might be better placed to have those meetings, or already has a relationship with those schools. And this is what we've done for this year. We've split them so our maintained schools have the meeting with their lead advisor for the school. So they have those meetings termly anyway. So it seemed a good idea that they would have a meeting attached to those about attendance. Now, again, like early help, we didn't expect them to be an expert on attendance. So we've met with them and made sure they know everything about attendance and put some guidance together for them as well. And they can come back to us and ask questions to make sure that our maintained schools have the same quality of meeting as our other schools. Special schools, again, we felt that SEND were in a better position. They're going to be interested in children that are attending or not attending. So they cover our special schools. And then our pros, we have a pupil reintegration team who are around exclusions, that they have the meetings with them. And then the rest of the schools are done by the attendance teams, academies and the independents. In addition, though, every school has an attendance team. So one of those 4 officers is attached to every school. So what doesn't get discussed at the meeting, or if it's just too detailed, or they're thinking of going on to a prosecution, then they can contact one of those 4 officers and have a conversation about it. As I said, all the data is shared with the different service areas as well. So that data I talked about earlier, that's shared with Futures, our youth offending, it's shared with our SEND team, it's shared with our pupil reintegration team. Meetings last about an hour and a half, depending on what they want to talk about and the attendance of the school. Next slide, please. So I talked about these 5 categories, and you can see them in more detail there, from our expected level of attendance down to our severe. And you can see the number of children, as I said, that we've got in that particular category. You know, what we're trying to do is stop them slipping down into that persistent, push them up to that expected. The next slide, please. So this is what our form looks like. Every school completes the same template, and we on the spreadsheet you can have 3 forms, so it covers the whole academic year. So you can kind of flick back to the last form if you want to kind of look at what was said. So in this case, you know, they can drop down. Their school name is already in there. We want their name of their senior leadership lead, their school champion needs to be in there, and we want to know that they're present at the meeting to make sure that school take their attendance meeting seriously. We've got the LCC lead and so on. And then you can see the LCC priorities are there. So we remind the school, this is what we're working on as a local authority. You may have similar priorities, or you may have something different. And if we try and get them to be quite specific with their priorities, it might be a year group, it might be gender, it might be a particular ethnic group and so on. So they've really thought about what their priorities are, so that we can kind of bore down into that. At the moment, we've still got a section just making sure they've got attendance policies, they're signed up to the DFE data sharing, and they've got daily processes. And that will stay on there until we get yeses on all of them. So that's a bit of the form. I've split it into 3 slides so you can see clearly. So that's first time. If we go on to the next slide, you'll see the next part of the form. And this is where they put in the data. Obviously, in the future, we can probably pour down that data for them. But, I mean, it's their data. So we're not going to challenge them on what they put on. But this is what they're working in. So we want them to kind of be responsible for that. You can see the 5 categories and the percentages that's split up into. We add in our Lincolnshire, and this form would be for a primary school, so we can see what the Lincolnshire data looks like for those groups. And as they fill in their data in the number of schools in each band, it will then tell them what the difference is between their school, for example, in terms of the number of children that are severe, and the Lincolnshire data. And so it strikes up a conversation about that. So why do you think it's different? Have you got more children in severe? Have you got number of children in PA and so on? To help them look at where whether they're improving over the years, we can see the historic data. So that's popped in there. So this score was expected has slipped into the at-risk of persistent absent over the last 2 terms. So you can compare that as well. So I think schools are quite like this. It's really given them a spotlight on their attendance. It allows them to compare to other schools within Lincolnshire, and it allows them to look at their rate of improvement. If we go on to the next slide, it's probably too small for you to see, but then there's discussion points. So with the conversation then leads into, so tell us about the children that are perhaps in the severe category. What are you doing? What have you got in place? And so on. Again, depending on the size of the school, whether that's individual children or whether that's groups of children. Schools complete this. We don't complete it for them. They add things to this. It's their form for them to complete. We guide the conversation. We challenge them. We ask more questions. but they complete it and then kind of return it to us when they feel they've got everything that was based on the conversation we had. On the right, again, not very clear, that will be the groups of children. So that'll allow us to have conversations about children that have a social worker, children, gender, is that something that they're looking at, ethnicity, and also ask them about children at alternative provision, children that have left the school recently, so we can see if we have a number of children that have gone EHE and that's high, we're probably recognising that there may have been some attendance issues around there that have, and then they've slipped out to electively home educate. And you can see there the attendance guidance that we have in place. Okay, so that's our targeted support meetings. They have been happening. We've done them with every school so far. Admittedly, some schools fill in the forms better than others. We know that's going to happen. We know that some schools are going to refuse to give us the data. That's all normal stuff within the first year, and I think the statutory guidance coming out in September might help us with some of that. And we know we've got to look at the new guidance in terms of categorising schools in terms of which ones we want to talk to more than others. But I think it was really important that we did a whole year, and we will continue this spring and into the summer with having a meeting with every school. Next slide, please. So working, as I said, working with families, we would encourage that work with early help to improve that attendance. So we have attended TAC forums or TAC forums have taken place where they focused on attendance. So that's been delivered to lead professionals. So we get that kind of expertise in there. And also, I said, we've delivered training, attendance tender to all our early help workers and consultants. So they have a certain basic knowledge of attendance and be able to perhaps challenge schools when they might be telling them things around attendance that might not be quite true. So they can come back to us and ask about that. Early help are involved, you know, we have to have an early assessment before a fixed penalty notice or prosecution. They're also involved in the EBSA pathway. They have to be there and in that return to school. So they're a key part in addressing those barriers to attendance for schools. Okay, next slide. Legal interventions. We have always had the opinion that, you know, it is a last resort, but I think the guidance that came in was, you know, was reinforcing that. And this is the statement from our strategy that we would be challenging schools. Have you tried everything possible before we take this route of a legal prosecution? And there are steps for them to follow in terms of engaging with the school attendance team so that they can challenge them as to whether they've done that and ultimately give it the okay to go forward. And I can't say that our fixed penalty notice of prosecutions have gone down yet, but we know that we're in that first stage of addressing this, and we're hoping to sort of for that to tip forward and start to go down. Okay, next slide, please. So just sort of, is it working for us? The little box at the top, you know, I'm not going to ignore the DFE data that we pull off the site, and for us that is showing that the attendance is improving. That's only looking at autumn to autumn, but it's a starting point, and I'm not sure that'll be the same when we get to the end of the year, but I'm really hoping that the focus on attendance that we did in autumn 23 has had the impact that we wanted, and the data is showing that, so that's a positive. I do really think that social care and early help do see the wider implications of not attending and those barriers. So they do understand educational neglect, not extending children to school, and that is something that needs addressing rather than closing the case because the only issue is that the child is not attending well. So we've kind of address that barrier. Still some more work to do, but we're certainly getting the buy-in from our social care colleagues on that. We have nearly all of our schools signing up to the DfE Share Your Data, and that's been a really positive response from our schools. So I think that they are on board with that. That means the data that we start to pull from there should be really accurate, and we can sort of use that going forward. And we have our targeted support meetings. We've done those for nearly all our schools as well. So I think they would appreciate the categories next year, but I think they also appreciated being in touch with us 3 times this year to really home in on that, what they need to be doing next, and sort of give them a good start on that. Our relationship with schools is good, and the attendance at our training is good. So that, I think that's helped to sort of sell our strategy and what we're trying to do. And our senior management support has also been really positive, recognising the importance of training, the attendance being everyone's business, and sort of seeing how it does sort of impact on how our colleagues work in social care and early help to help us address that. I'm thinking that's the last slide for me. Yeah.
It is perfect. Thank you very much, Jill. Loads of really good stuff in there, and hopefully lots of useful tips for people in how, when you've got a broad range of different types of need and different type of community in your local authority, or just a large number of schools, how you go about some of those things. And the similarity to Rutland's example in sort of taking a step back, recognising what you can and can't do as within the constraints of the resource you've got, and thinking about how you best use other parts of the local authority to help you deliver it. Any quick questions for Jill before we finish? I've got one if we haven't got any hands up, which is just, I suppose, if you were starting again, Jill, what do you know now that you wish you'd known then, for people who are at an earlier stage?
That's an interesting one. I mean, I think we took on a massive challenge to try and do 3 meetings with every school at the same level of intensity. And I think that's been recognised, hasn't it, in going forward.
Yes.
So in some way, I probably would have looked at that in more detail, maybe rated schools, and tried to get to the schools that had the greatest need straight away, and I think and come back to the other schools at some other point. But at the same time, often a school that has good attendance really do want you to come and see what they've done and what they're doing, and we learn a bit about good practice. So it does balance out in the end. But I think the big numbers just felt we had to have some consistency across what we did to start with, and now I think we're in a good position to move forward and change that.
Yeah, and those local authorities who are at the sort of early end of implementing targeted support meetings, that's what they found, and that's part of the reason why things have shifted slightly, which is that at the beginning there is that level of need for a regular conversation, building the relationship, getting the sort of joint working, and then after that you can have slightly shorter and more focused conversations, or less frequent. Lovely. Well, thank you very much, Jill, and thank you, as I said, to Andrew, for your honesty, your openness, and willing to share with your peers across the region. Thank you, everybody, for being here. Vicky's put into the chat the link to the rest of the series. As I said, if there are specific examples that you're looking for, people who started from a traded service, or people who started with a very small team or an urban area or whatever, there are case studies in there that will be able to help you if you didn't get all of that from today's examples. And with that, thank you very much for being with us, and thanks for everything you're continuing to do, and see you shortly. Thank you.